Almost all of us know someone who has suffered or died from heart disease, cancer, lung disease, or diabetes. Non-communicable diseases kill more people than any other cause of death worldwide. This includes 15 million people who die each year in their most productive years, between the ages of 30 and 70. The vast majority of these premature deaths do not occur in rich nations, but among the poorest people in the poorest countries. The marketing of health-harming products is devastating these countries. Products like tobacco, alcohol, unhealthy drinks, and foods heavy in sugar, salt, and fat are marketed in rapidly urbanized areas with little legislation or regulation. People are becoming less physically active. The air they breathe is getting dirtier, turning these countries into the new front line in the battle against NCDs. At the same time, lack of access to life-saving medicines like those to lower blood pressure or even insulin and vaccines to protect girls against cervical cancer is endangering millions of people. But much of this suffering can be avoided by doing a better job of preventing disease in the first place and ensuring people can get effective treatment if they need it. For example, through policies that strengthen tobacco and alcohol control, help to improve diets, and increase physical activity, and by expanding universal health coverage to ensure that all people, no matter where they live and how much they have in their wallets, can access the health care they need without being impoverished by paying for it out of their own pockets. But for this to happen, we need commitment and investment from the highest levels of government, because preventing and controlling NCDs is a health issue. It's a finance issue. It's an education issue. It cuts across so many areas of life. This is why the Global Conference on NCDs, being organized by WHO and the Presidency of Uruguay in October 2017, is such a landmark event. We will see heads of states, along with leaders from multiple ministries and sectors, gather together at this truly unique opportunity for the world to rise to the challenge posed by NCDs and to meet commitments set by the Sustainable Development Goals, including the reduction of premature deaths from NCDs by 1/3 by 2030. It's a loud reminder that we cannot sit by and allow our current and future generations to be afflicted by this largely avoidable threat. Thank you, and see you in Montevideo, Uruguay.